My name is Nick Lologis. I've been practicing gynecology for a long time. I've been a doctor for 45 and for the last 37 years I've been practicing gynecology. I was told by my mentor that when I do vaginal procedures in my rooms, don't hurt the patient, otherwise she won't come back. So I've always been gentle with my vaginal examinations and my pap tests. But there are some women who hate having these examinations performed. They've been hurt in the past, or they just have a fear of something going into the vagina. For some women, this whole procedure is frightening. And a lot of them ended up having a general anaesthetic just for a pap test. And I can remember doing this for a number of women. However, a few years ago, a new analgesic agent became available on the market. It's called Penthrox, or the green whistle. And this is a fantastic drug because it allays anxiety and reduces pain, and it's a simple inhaler. So the patient inhales this gas, methoxyflurane, for about 5 minutes, and then you can examine and do a pap test quite easily. And when I started using this, I thought, well, can I use it for other things? Absolutely. I use it now to insert intrauterine devices for contraception in some women who are frightened of having that procedure but don't want a general anaesthetic. I use it to insert the Implanon contraceptive device and use it for its removal. It sort of changed the way I view doing office procedures. So women who need to have a biopsy of their uterine lining, if they've had postmenopausal bleeding or heavy bleeding, or if they want to have a biopsy looking for immune issues as to why they can't be pregnant, or where some protocols in IVF deem it necessary to scratch the uterine surface about a month before the IVF cycle. I can do all these now with Penthrox inhalation. It's fantastic stuff. And you can extend it even further. I've used it to do embryo transfers, to place embryo glue into the uterus. I know some of my colleagues use it for colposcopy, looking at the cervix and taking biopsies. And I've used it for patients who have minor skin lesions around their labia minora or majora, or around the anal area, to remove those tags. So it is a drug that has fantastic use in the office for the gynecologist, and I understand that it is now almost worldwide. It's used mainly for pain relief after trauma such as fractures, but they're even thinking now of using it possibly in labour wards to ease the pain. It is a fantastic drug, and the beauty of it is that you can puff on it. It causes nothing but pain relief, and it allays anxiety, and then you stop puffing on it and you wake up and you can drive home. It is absolutely fantastic, and I think that it should be used more often in the office.